Welcome to episode 59 of Inside Deschutes County. Whether you're on the go, at home, or just looking for something new to listen to, thanks for making us a part of your day. Don't forget to hit subscribe on your favorite podcast app or stream every episode anytime at deschutes.org/podcast.
Deschutes County is an amazing place to live,
work, and play.
Great place to raise a family.
I love the weather and the high density.
At Deschutes County, we provide excellent service.
Beautiful.
We're here to help you.
Deschutes County is the heart of Oregon.
Everyone wants to be here.
Welcome to the Inside Deschutes County podcast. I'm Eric Breon. So glad you're with us. Well, today we're talking about something that touches just about every household. It's respiratory season coming up. Immunization's an important topic to talk about, whether it's flu, COVID, RSV. All of these illnesses can affect our families, our workplaces, just our community in general. We're joined today by Dr. Richard Fawcett, our County Health Officer, and Sarah Van Meter, who leads our Immunization Program at Deschutes County Health Services. Welcome to you both. Thank you both for being here.
Thanks
for having us.
Well, this has kind of become a recurring podcast episode a little bit. I feel like, Dr. Fawcett, you could be a co-host.
Well, I hope not.
I think this is 4 times, but it's an important topic. So I think it's important that we keep bringing you back because things keep changing. It just seems like there's always something new when it comes to respiratory season, how access changes, and kind of the ever-evolving recommendations. So if you don't want to co-host, we'll just keep bringing you back anyway, having you dish out some good information.
I guess
How about
around
that?
the fall or winter, that comes up a lot, so I'll try to make
There
it.
we go. There we go. Well, let's dig in a little bit. What is the concern this year about respiratory season? Is there anything we need to be maybe more aware of this year? Dr. Fawcett, I'll let you go since you're the recurring guest.
Okay. Well, thanks for having me
Although
back.
Sarah's been here a couple times now, too.
Sure.
Yeah.
I don't want to leave that out.
We came together one time, maybe about a year ago.
That's
think.
right.
Yeah.
That's right.
Yeah. I don't think anything is really truly new. I think we know that, our seasonal respiratory illnesses tend to be influenza A and B, and RSV, respiratory syncytial virus, probably the latter a little bit more commonly seen in children. So I think these are seasonal infections, and especially, winter, early spring, even maybe late fall. And every season, the peak when it's, happening the most frequently in terms of getting influenza or catching RSV, it changes a little bit, but it's pretty much the colder months. So we're coming up on that again, and looking forward to see what we can do to try to prevent transmission and keep people out of the hospital. So it's very similar to, I think, almost every fall, coming back to school, out of summer, thinking about getting people protected for the respiratory season.
There was a little bit of talk about kind of a COVID uptick this summer.
Yeah.
That kind of, I don't want to call it a spike, but maybe it just went up a little bit.
I think it's a
what
spike,
are you
yeah.
what are you seeing in regards to that now?
This has been probably 2 or 3 years where we tend to see a surge in COVID-19 towards the end of the summer, August, September. Looking at our data, I think we have some data that can mine some of the test results from the PCR test that you get with the nasal swabs. And so looking at all the tests that, from this region, including the St. Charles laboratory, we get test positivity rates of 16, almost 17%, which is pretty respectable. I would say a surge, typically when it's really going around years past has been 20%. So we got up that high, whereas early in the summer, probably, 2-3% of all the tests were positive for COVID-19.
Why do you think end of summer? Is it just people out and about?
I think we think about that. We have a lot of tourism. We have a lot of folks coming here in the summer. So we have a lot of people from out of town. It's hard to say. I think about busy hotels, busy restaurants, indoor events where there's a lot of crowding. It's hard to know, but I think there's a lot of folks here in August and maybe even in late July. And so I don't know. It's a good question. But if you look at the trend, almost every year now, the last 2 or 3 years, we see this upsurge in August and September. So we've done that again. And it looks like it's stabilizing now that we're coming towards the middle to end of September. I think the data goes through the middle of September. So keeping my fingers crossed. So.
Which brings us to Sarah's job. Immunizations, right? What are you seeing locally in terms of vaccine uptake a little bit? In terms of, are people keeping up with these vaccines, COVID, RSV, flu? I know we're heading into, but what do you think?
I really see a lot of my folks coming in that are just the diehard by the I want to get it in September.
They got it on their calendar.
Got to get it, yeah. And really, I have been just kind of gently trying to assure patients that getting it into October, waiting until October is fine. Of course, unless you are immunocompromised or have some major underlying health issues, it's okay to wait until October, and it'll last you a little bit longer because those flu and COVID, they're effective for about 5 to 6 months, depending on your immune system. So it's okay to wait until October. I do see some people that are worried because they have trips coming up and they want to get protected before they go on their trips. And so getting it in September is fine, of course, still to maintain that. But
access to vaccines has probably become a little bit of a question mark lately. What are you seeing in terms of maybe questions coming into your office about, hey, how do we get this stuff now? Because it just seems like things are changing in the world, and we're just having to kind of navigate those waters a little bit. Are you getting a lot of questions about that?
Oh yeah.
Oh yeah. She's like, yes, Eric.
It's been a full-time job to make sure that
job security for Sarah.
Well, and more just making sure that my front desk staff knows what's going on. So it's really been great as far as teamwork goes, making sure that we're all dispersing the accurate information, or as accurate as we can, and have it, because really we're finding out just about the same time as everybody else is, but trying to stay on top of the information has been a little bit of a struggle, because it's been a different kind of respiratory season as far as the planning for these vaccines go, because typically decisions have been made on an approval given back in the springtime so that manufacturers can begin to process vaccine and get it distributed in time. And so usually CDC has approved everything back in the spring. But as some people might have already heard, the FDA came out with their recommendations late August, and that kind of shook things up, because typically the CDC would have already given approval. And so the Advisory Committee on Immunization Practices didn't even meet to vote on COVID until the end of last week. And by then, everything was already askew, I would say. So everything's just, nothing is lined out the way that we've seen it line out for COVID vaccines in particular the last couple of years. And so I think that really concerned a lot of people, and rightly so. People that are concerned that they have health issues that they're worried about, and so they want to stay on top of their boosters. But we, as you might have already heard in the news, Eric, that back in the beginning of September, Oregon joined Washington State, California, and now Hawaii to form the West Coast Health Alliance. And that has greatly opened up vaccine access, especially for COVID, to everybody in the state. So that's been a major thing for all of us.
I was going to ask about that, and we'll dig more into the West Coast Alliance. But access to vaccines, it just seems to change year to year. And so maybe you don't have all the answers to this question, but what is, I'm trying to break it down simply for people. What does access look like? Because it's your primary care. People think of pharmacies, people think of, maybe clinics. What, and then obviously, do we have it, just in general?
Yeah, we do. Yeah.
Okay. So what does it look like?
it looks a lot better now. Before, when the FDA came out with their recommendations for the on-label, what they call the on-label use of vaccine, it limited what pharmacies could do. And so, at least for the state of Oregon overall, people had to go to the pharmacy with a prescription in hand. But now that this West Coast Health Alliance has formed, it's really opened things up. As of the end of last week, well, actually last Wednesday, so on the 17th was when the West Coast Health Alliance came out with their own recommendations, and that just opened things up across the board, where no longer do people have to go to the pharmacy with a prescription just to get a COVID vaccine. And it really flipped the switch, so to speak, for our pharmacies just to be able to give access to anybody that wants a vaccine, which is a beautiful thing. And we do, there's a lot of catch-up to play, and about 90% of the vaccines, that respiratory season vaccines, are given by the pharmacy. So it's really, that's what we really look to see, how easy it is for people to get in. Because if pharmacies are having difficulty receiving vaccine, then it's difficult for everybody. But now I think that shipments have like really been flowing in, and pharmacies are just doing the best that they can to take everybody that they can, and for their walk-up clinics, and just get as much in as they
to maintain
can.
Inventory as they dispense the vaccine. I think they're ordering more, but it does make it a lot easier to dispense the vaccine. Just by people who make an appointment want to get a vaccine, or just who walk in without having to have a provider's prescription, which is kind of where we were a couple weeks ago. But I think it's the efforts of people who see patients, so whether it's nurses, nurse practitioners, clinicians, pharmacists, to try to protect the public against contagious diseases during, the peak seasons, which for influenza, RSV is going to be, the colder months, so winter and early spring. And COVID-19 will continue through the winter as well. So now's a good time to try to get the vaccine out, and to have the impediment or kind of the hindrance of, I didn't get that prescription from my provider, I think makes it more difficult. And, sometimes you have to actually go in and have an appointment to get it. So, but I think it's moving in the right direction, so that there's efficiency of access to the vaccines like we had last year.
What are you hearing? This may be a silly question, but what are you hearing about the effectiveness of the COVID vaccine? Because we had, when COVID first came out, it was, a lot of talk. It was gonna fix the problem, and then it was gonna reduce the number of deaths. Is the COVID vaccine evolving, or is it improving? What are you hearing in the medical community about the vaccine in general? Because I think a lot of people have questions about that.
Yeah. For about the past 3 years, roughly, the COVID-19 vaccines, most of which are mRNA vaccines, have been updated specifically to protect the public against variants of Omicron. So Omicron is, a mutation or a variant of COVID-19, which is, at least in this country and throughout the world, by far the dominant type of COVID-19 infection. Fortunately, it's a lot less lethal and severe. It is very contagious, but it's still the chance of ending up in the hospital or dying from it are much less than the original COVID-19 strain. So, but there are subvariants of Omicron that change a bit, and so if the newest boosters are not quote unquote updated to try to be directed against some of the more recently circulating strains, they're not as effective. A little bit like kind of what we do with the flu vaccine.
The flu. I was going to ask.
But not quite the same, but that's similar. So there is that effort to try to protect the public against the strains that are circulating at the time that the COVID-19 will be more, surging in a community. So each fall, it's been in the fall, typically late summer or early fall, those COVID-19 boosters have been updated a little bit. So that's kind of what they do. So I think it is better. I'm glad it's that the COVID-19 boosters, the updated vaccines protect you against Omicron, and it's just not directed against the original strains because that wouldn't do you nearly as much good.
Sarah, you must feel like a school teacher, like with the education that has to go with all the nuance of, the vaccines, the access, the alliance. What are you and your team doing to kind of educate people about access, getting these things? I imagine it's almost a 24-hour a day job, just kind of like, okay, gotta get it out, gotta get the word out. Like, here's where to go.
Yeah. So, and I love it. I love educating. I never really get tired of it. And thankfully, every season has been a little bit different as far as, how things have been set up for respiratory season. Not to harp on COVID, but that's been the thing that has been that's been constantly changing. So, we just try to make sure that we're communicating as this communicable disease prevention and management team, where we are trying to put out media releases. And as I said before, we're trying to make sure that the people that are answering the phones at the county are as up to date as they possibly can be. And then also, we have a really up-to-date website that there's a lot of links, so if people had further questions on our website, you can just click the link and find out even more. So we're updating that daily or as news comes in. So
which is often.
Which is very often, yeah.
Oh.
Off of the Deschutes County Health Services website, it can be found, and as soon as I get COVID vaccine in from our state supply, then we're going to update it there, and of course make sure that we can get the word out any way we can to let people know. If they haven't been able to make it into a pharmacy, they can schedule an appointment with me and come in.
Well, I was going to ask that. What's the best advice you would give to people who are trying to make a plan for respiratory season? They got concerns about it all, right? I mean, COVID, flu, RSV. Where do I get it? Where do I go? Where do I start? Do you start by going to our website? Do you start by talking to your PCP? What advice would you give them in terms of how to plan out this season?
Well, I could, start by saying, during the winter month, the colder months, so winter, spring, early spring, late fall. So we're talking about, November, December, through probably March. In Central Oregon, there's going to be a little bit more time spent indoors. And so certainly for influenza, RSV, that's when we always see these infections, these diseases spreading and peaking. Like I said, it might be a little bit different each year. We had an unusual peak last year in the summer with influenza. It wasn't very high, but for the most intents and purposes, every year it's pretty predictable. I think the same will kind of go for COVID-19. It really, truly isn't. I don't think I would call it seasonal because it can surge at different times. Like I mentioned, August, September, that's definitely not cold. Those are not the winter or even fall months, really. But we continue to see COVID-19 transmission in the wintertime, and that makes sense depending upon, crowding and transmission opportunity, spreading events, if you will. So, we definitely want to do whatever we can to try to decrease the risk of transmitting these very contagious viruses. And for adults anyway, influenza and the Omicron variants of COVID-19 are really very contagious. They're amongst some of the most contagious pathogens that we really know about. Measles would be another one. It's another topic, but still, it's almost at that level in terms of how contagious it can be. So we want to do what we can to try to get folks to be just conscientious about if they're not feeling well, stay home from work, hand washing, having some distance between those in a small room, for instance, 4 to 6 feet, especially if you have a cough or you think you might be getting sick. So some of those common sense interventions are important too. But vaccine is also extremely important and probably the most helpful way to prevent these infections from being transmitted, in your household or in the community. So anyway, so I think the message is the same as it was last, summer and fall. Really, that the vaccines are a very important prevention strategy.
And
for sure.
I imagine the strategy is pretty similar in terms of the groups that you're targeting. Children, we've got school exclusion day that happens every year. We've got, maybe older folks or people who are in big groups, work in restaurants, those kind of things. Is that a strategy of your team to kind of focus on any particular group?
I mean, we always worry about, across the spectrum of disease. We worry about our very young and our very old, right? So I basically will take anybody and everybody that I have vaccine for. Bring them all in. Bring them all in. I will welcome you. And for those people that have any kind of worries about any kind of underlying health issues that they have, I always recommend talking to your physician first. But most people that want a respiratory season vaccine, they have their own strategies, and they know when they like to get it and where they like to go. And mostly it's just about the conveniences for them. So I'm so happy that people are allowed to have it without a prescription, because it makes it so much easier if you want to get your flu and COVID vaccine at the same time. So really I think that's what it comes down to for busy people or parents trying to get their child in to be seen. And of course, pharmacists only take 7 years and older, so that they give vaccine to. So it is about making sure that you're getting your child in for their well child appointment, because that's a really opportune time to get their flu and COVID vaccines. And then for older patients, just calling ahead if they need to see if the appointments are available at their pharmacists or the pharmacies. They can book online as well, so they don't have to wait around. But yeah, anytime, I welcome questions. If people have any questions that aren't really comfortable working their way around a website, I do take a lot of phone calls from our older population that just, they just need to be pointed in the right direction.
Well, it's a tricky topic at times, because we know the landscape in our worlds, and a lot of people can be vaccine fatigued, in terms of information, or do I get it? Do I not get it? You've got the people who've got it on their calendar. They're going to get it every year. What about the people who don't have it on their calendar? How do you reach them? What's the strategy there? And get them protected while not feeling overwhelmed?
It's the constant struggle.
I think so. And I
struggle.
think, being available, trying to update the website. Sometimes, we do have access by phone too. It's a little tricky if there's a lot going on and it's really busy. And I think we really try to stay in touch with our community in terms of healthcare providers. We had even this week we had a kind of conference call with all the clinics, I think, talking about these issues of vaccine availability and recommendations and what happened with ACIP and CDC, et cetera. So we're really trying to reinforce good availability, a clear message. There will be variance to the message from time to time, but really it's not that much different than last fall. So hopefully there's some availability to your provider, your physician, your nurse practitioner, et cetera, to the health department when questions come up, to our website. But we want to be available for people when they have questions, and we don't have a ton of time. We have a couple of months or so in terms of, at least for influenza vaccine and maybe for COVID-19 as well. But we do want to be available, especially right now.
That's a good example of partnerships that worked. Are there other things that work in terms of, like, I don't know, is it a mobile clinic? Is it partnerships with other providers or pharmacy partnerships? What does work?
I think
all of it.
All of it, yeah. It really, part of what we've been. I have another teammate that we do something called the IQIP program. It's called the Immunization Quality Improvement Program for physicians, and we are just we try to just form basically, and I have an immunization coalition, and we just try to keep the communication going, whether you're a private practice or, another local public health authority like Jefferson County or Crook County. I just want us to all make sure that the lines are open for good communication so we can help each other out, because in the end, we're all in the business of helping people. And so oftentimes with Jefferson or Crook County, we share vaccine, we share information, and same with the clinics and other physicians. We just want to keep those lines of communication open. And as far as just trying to make sure or to engage people, it is, about to be the season. We're heading into Thanksgiving and Christmas. And I always want to make sure people just understand what it means to to be healthy, to enjoy that holiday with your family. Again, probably some young folks and some old folks in your family that you want to make sure that you're not part of the problem, of spreading something when you're traveling. So I like to have people keep that in mind, as they think about, I might not have time for this. I don't have time to stop and get a vaccine. And it is hard. Everyone's busy. But if you can fit it into your schedule, I think that Oregon the Oregon Health Authority is doing their very best to make sure that people have access. And so,
beyond vaccines, are there things that you recommend that people should do in order to stay healthy? I mean, there are probably some simple answers in there, but...
Yeah, I think we mentioned it briefly. I think to be conscientious that, if you have respiratory symptoms, especially if there's a fever, you have flu-like symptoms, to be really cautious about how close you are to people. Maybe not going to work would be great. Sometimes we'll see folks in healthcare where they're just feeling sick and they need to come to work. They don't want to, rely on backups, et cetera, to come in. And I get that. But at the same time, we have to be washing our hands, wearing masks if we're ill.
All the things.
Yeah, like I said. And trying to stay home when you're not feeling well is very important. And I think that's, the same thing applies when you're traveling. It's a great point that Sarah makes. I mean, Thanksgiving holiday, the winter holidays coming up, people get together a lot, around New Year's. So probably the chance that you'll be around somebody who's more, medically fragile, who's more vulnerable to some of these respiratory infections is pretty high. At least there'll be a day or two between now and, the beginning of January that you might be, interacting. You might have some of those folks living in your home. So, I mean, nobody wants to spread a contagious disease, but sometimes you do it unintentionally. And a good way to prevent that is to get vaccinated or to be really conscientious when you feel like you're starting to not feel well.
Yeah, a lot of community events indoors this time of year, too. I just think about, all the gatherings inside and just kind of takes you back a little bit and reminds you that we should probably be a little careful about those things. Sure. If there's one message that you want people in Deschutes County to take away about any of this season, immunizations, being safe, is there something in particular you would say, or did you just nail it with your last answer?
I think it's pretty close to what I just mentioned. We have an interest because we study it and we think about it and we talk about it every year to really try to protect the public from preventable and if not fully preventable, at least contagious diseases. It's always sad when it spreads to one person to another, and finally gets to somebody who really is vulnerable and has to go to the hospital. So, and having practiced here during, the beginning of COVID-19 and been at the hospital and seen that, or still now during the flu season, seeing more medically fragile people in the ICU. It's just, it's a hard thing. So we want to prevent that as much as we can. And that's really our main focus, to be honest. And we don't want people getting, sick either because they're on too many medications or they're taking unnecessary strategies to treat illness. But really, during, the respiratory viral season, we're all about preventing transmission.
I'm always amazed at the work you guys do because it could feel of course, I'm an outsider looking in as to what you guys do. It could feel like Groundhog Day. Every year, here we go again, a broken record. I mean, what motivates you guys to keep going and doing this? Because aren't you tired?
No, I think it's really exciting because, it just goes to show we get to see the results after the prior respiratory season. We get to see, hey, vaccines work. The data. And yes, washing your hands works. It sounds simple, but it's so true.
We made a difference.
Yeah. But yeah, we I think it's just it never gets tiring, and of course certainly not boring this year with all the vaccine in the news and everything. But I just want to make sure people don't get caught up in the hype. Just make sure you reach out to your trusted, your primary care physicians, your nurse friends, your doctor friends, reach out to us, check out our website. I just want to make sure people understand that we got your back and we want to help you, make sure that you're feeling safe going into the holiday season. I just want people to feel taken care of. So and that never gets boring to me. Yeah.
Well, lots of good information, very important information, and I really appreciate you both stopping by.
Well, thanks, Eric.
Thanks for having us.
Again, that was Dr. Richard Fawcett and Sarah Van Meter from Deschutes County Health Services. As they shared, vaccines are one of the best tools we have to stay healthy during respiratory season, and access is improving thanks to local clinics, pharmacies, and partnerships across the West Coast. For more information on where to get vaccines in Deschutes County, visit deschutes.org/health. We want to thank you again for listening to Inside Deschutes County. We really appreciate all your comments, your feedback about the show. You can find us wherever you listen to your podcasts or at deschutes.org/podcast. But until next time, please be healthy out there.